Thank you very much and good afternoon. Today, of course, being Monday, we're reporting on the three periods from Friday to Saturday, Saturday to Sunday, and then Sunday to today. Between Friday and Saturday, we had an additional 750 cases of COVID-19 reported. On Saturday to Sunday, 731 cases. And from Sunday to today, 596 new cases in BC. Additionally, as you know, we had some challenges with lab reporting and reconciliation of the data last week in Fraser Health, and we have cleaned that up over the weekend thanks to the hard work of the epidemiologists. So there are an additional 277 historical cases that were added to the database between November 18th and 26th. So that brings us up to a total of 2,364 cases over the past weekend, 10 of whom are epidemiologically linked, for our total of 33,238 people diagnosed with COVID-19 in British Columbia. That includes 371 people from the Vancouver Coastal Health Region, 1,365 new cases, plus the additional 277 historical cases from the Fraser Health Region, 58 people in the Vancouver Island Health Region, 212 people in Interior Health Region, 73 people additionally in the Northern Health Region, and one new case in a person who resides outside of Canada. We now have 8,855 active cases in the province, of whom 316 are in hospital, 75 of whom are in critical care or ICU. We have 10,139 people right now under active public health monitoring and 23,111 who have recovered. This weekend, we had an additional 46 people who died from COVID-19 in British Columbia, which is the highest number we have ever had. 441 total in British Columbia. And my heartfelt condolences go out to the families of each of these people. Each of these husbands, wives, sons, daughters, grandparents, all of whom lost a loved one this weekend. We all feel your loss, and we mourn with you. And I want to, as well, express the pain that I know that the caregivers in the communities that these people lived in also are mourning their loss this weekend. Most of the people, about 80% of these people, were people who lived in long-term care. And it reflects right now the challenges that we have in dealing with this virus in our communities and the fact that it can cause such devastation when it gets into our care homes and the impact it has on seniors and elders who are so important to our history, our family, and our community. We also have 5 new healthcare outbreaks in Mountain View Village, Fleetwood Villa, Lakeview Care Centre, St. Jude's Anglican Home, and Veterans Memorial Lodge at Broadmead here in Vancouver Island. 2 outbreaks were declared over at the Kiwanis Care Centre and Louis Breyer Home. We now have 57 active outbreaks in long-term care and assisted living and 5 in acute care units here in the province. And right now we have 1,338 active cases in long-term care, 847 residents and 487 staff. There, in addition, has been one new community outbreak at the Newton Elementary School in the Fraser Health Region, which has been closed for the next 2 weeks, where students and staff are self-isolating. I do want to take a moment to really recognize the incredible work of our teams in each of the long-term care homes and healthcare settings. Healthcare workers have been at the front lines, or maybe the last line of defense right now, but have been working so hard in our long-term care homes, and I know how challenging it is And I'm with you every single day, supporting you and in admiration of the work that you're doing. It's also very easy for us to focus, as we have been from the very beginning, on our daily numbers. And I just want to talk about that a little bit, because as we've recognized over the past week, there can be challenges sometimes in what those numbers actually mean. They have become an important measure both here and across the country. And I know many people look to the daily statement and the update on the BC CDC dashboard. The process to compile this information, however, is still arduous, and it takes the work of many epidemiologists across the province every morning to figure out exactly who's new in every single day. The challenge is that these are living, ongoing databases, and a daily number is really a snapshot in time. And as our cases have increased quite dramatically over the last few weeks, the processes that we've used to do that have been challenging. As we know, sometimes there are issues, and we have corrections that need to be made. And today, for example, we did a revision and added the additional cases that had not made it into the daily list, even though each of those cases had been notified and that public health was following up on them. I do want to again thank all of the team at the BC CDC and our health authorities for the work that they do every day, and again the work that we did through this past weekend to reconcile the numbers that we have and make sure that we are reporting everything in the statistics. In the coming days, however, we will be switching our systems to further automate some of the functions to make it easier, so that we're not spending our time focusing on addition and adding the numbers and being able to reconcile databases and able to use the work of the epidemiologists to understand more fully the contacts and the cases and the outbreaks and clusters in the community. So these daily numbers are important, and we recognize that, but it is a snapshot, and what we need to track is the trends. Are we going up? Are we going down? Are we leveling off? And we will be adding in a more fulsome way, the measure of the rolling daily average over a given week, or what we call the 7-day rolling average. And that is on the BC CDC dashboard, but we will be talking more about it in the coming weeks as we automate these processes, so that you have a better understanding of how we look at the trends over time. And of course, what we want to see is the curve trending down. So this has been, I don't need to say, a challenging pandemic for all of us, particularly as we're heading into the middle of this second wave. So many of the usual ways that we make those important connections with our families, friends, our communities have been paused or significantly changed because of COVID-19. Many occasions and daily life activities we would normally do together, we must now do apart. Despite how difficult it is, and we know how challenging it has been in these last few weeks, I am heartened immensely that most people in BC are doing the right thing. And I am grateful for that. And I thank you, and especially I want to reach out and thank the faith leaders who are supporting their congregations safely in these most challenging of times. People are following these orders and using our layers of protection for two important reasons. It's our responsibility we have to each other and to our fellow citizens, and it's how we show we care. That is how we are going to make it through this pandemic. We know that COVID-19 is a serious, life-threatening illness with severe consequences for many, young and old. This past weekend, as you know, we had the largest number of people die from COVID-19 in our province. These people have faces, have names, have stories, have families. And while it is the families of those who died we are feeling the most right now, this tragedy is all of our tragedy, and we all mourn their loss. If you are thinking that it may be okay to bend the rules, please remember that this virus takes lives. and it is the lives of those who are closest to us that are most at risk when we take risks. I was also contacted by many faith leaders and others this weekend to talk about some of the issues that we are dealing with, and was reminded in many ways that faith is not a building, that it's not about Sunday mornings, but it's about every day and how we connect with each other and how we support each other. It's not about rights, but it's about community and responsibility to our fellow citizens. And I think we are seeing that around the world with global faith leaders showing an example across the world. And as I was told many times this weekend, that we have many seniors and many elders who are precious to us in our communities, and we want and need to protect them. We are facing a significant storm surge, and this is why right now we need to come together again. We know there is vaccine on the horizon, and that is our goal. That is what will help us get through the next phase. As Pope Francis reminded us this weekend, looking to the common good is much more than the sum of what is good for individuals. It means having a regard for all citizens and seeking to respond effectively to the needs of those least fortunate. We need to push back on COVID-19, united and together. If you are in doubt, remember you are not alone in your sacrifice. Most people in BC are doing it with you. We know most people are wearing masks. Most people are sticking to their households. Most people recognize, they understand the importance of stopping this virus and stopping transmission in our communities. It is our collective effort that makes the difference and will see us through this storm. We have done this before, and we can do it again. And I ask you, please, do your part today to show community, to slow our transmission, to slow COVID-19 without exception. Your actions protect everyone, those you love and those you don't know. We will get through this, and we will do it by being kind to each other, by being calm and being safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to add on behalf of the Premier, I think of everyone in the province, to express my condolences to the families, the friends, the caregivers of the 46 people who passed away over 3 days, the last 3 days in British Columbia from COVID-19, 15 from Friday to Saturday, 17 I should say, from Saturday to Sunday, 14 from Sunday to Monday, 35 of them in the Fraser Health Authority, 11 in the Vancouver Coastal Health Authority. As Dr. Henry said, this is a difficult and gutting time under these circumstances, and our hearts go out to everyone. We are thinking of you. We grieve with you today. I wanted to note that we have 316 people in hospital today, 8,815 active cases, 10,139 people under public health surveillance. That our emergency rooms in our hospitals continue to perform exceptionally well under the circumstances. As you know, when base and surge beds are taken into account, our overall hospital capacity today is 69.7% of beds full. Our ICU capacity is 52.8% of base ICU beds and surge ICU beds. And in fact, our total capacity is only 74.3% of base ICU beds. And so we are able, in terms of beds, to deal with it. But as all of you will be aware, when COVID-19 is this present, as it is in some parts of our healthcare system, I think in particular places such as Burnaby, places such as Lionsgate Hospital, Burnaby Hospital, and Lionsgate Hospital, it is an extraordinary challenge for our staff. And it reminds us why we have to, when in doubt, rule things out. I've heard some people say that they had some concern or misunderstanding about the new orders, that events that may have been okay before the orders could go ahead because they were okay before the orders put forward by Dr. Henry the week before last. That is not the case. It is time, I think, when there's any doubts, to rule events out, to stop as much as possible the transmission of COVID-19, and to do so because it impacts directly the lives of people we love, of people around the community, people we don't know. And so I encourage people to take those steps right now, especially through December 7th, 1 week from today, when those new orders will be reviewed, that people dig in right now. And I have a lot of confidence in the willingness of people to do so. I spent, as Dr. Henry did, quite a bit of time last week speaking to faith leaders of all faiths and and many denominations of particular faiths. And I was impressed. There's always focus on some people who have concerns with the rules, who want to go outside the rules, but the overwhelming effort by people to be part of the healing in BC, to be part of the support for one another in BC, and to not proceed with traditional worship services that are beloved, after all, is something that's very encouraging. And I have to say, in my weekend, my observation is that people in BC were extraordinary this weekend, and I can only express my appreciation to all of you for that. I wanted to bring updates to issues that we regularly do on Monday, just to note with respect to our influenza vaccine measures that, as you'll be aware, we've ordered 2,241,600 doses of vaccine this year. That's a 47% increase over last year's available doses, which was 1.5 million. As of November 26, 2,041,540 doses of flu vaccine have been sent out to regional health authorities. And as of November 26, we know that at least 1,206,006 doses of influenza vaccine have been administered to British Columbians. We also know that the number of doses administered is higher than the $1.2 million figure, as there is a reporting lag of up to 30 days from pharmacists and physicians and community providers such as nurse practitioners. Most importantly in that, and I wish to express my appreciation to the pharmacy community around BC, I would note that last year, as of November 26, pharmacists had distributed 606,858 doses of influenza vaccine, and as of this year on November 26, that number was 896,935. In addition, 200,000 plus doses under the medical services plan from physicians, nurse practitioners, and registered nurses, and 100,000 plus doses of influenza administered by public health. So we are in the hundreds of thousands ahead of last year in terms of the doses distributed. And when you consider for public health that this has taken place during a period of the period of COVID-19, I am very, very appreciative of that effort. On Monday, we also provide an update of PPE received over the past week. As you'll be aware, over the last since March, we've the following PPE has arrived in BC and been approved: 7.7 million N95 or equivalent respirators, almost 130,700,000 surgical or procedure masks, 2.9 million pieces of eye protection, including goggles and face shields, almost 235,400,000 pairs of gloves, and just over 15 million gowns. In the last week, the number of the PPE that's arrived in BC since November 23rd is 30,586 N95 or equivalent respirators, 1,863,000 surgical or procedure masks, 8,782 pieces of eye protection, 21,448,000 pairs of gloves, and 1,963,000 gowns. As noted, and as I noted last week, there was a significant arrival at YVR earlier in the month. All of this material, as we go through a process, is being processed into inventory and tested now. That includes 43.2 million pairs of gloves, 24 million procedure masks, and 105,000 gowns. And finally, I wanted to note, I think, that what all of us know is that COVID-19 is not a passive foe. It doesn't argue. It doesn't demand. It seeks to find, it seeks to transmit from one person to another. That's what it does. It does it in our workplaces. It does it in our homes. It does it in our communities. It is relentless. And especially in the winter months, and we have seen this, when the nature and location of our contact with each other change, it is significantly greater, the transmission of COVID-19 right now, than it has ever been. We must not be distracted from our focus. We've got to make sure we're consistent in taking the actions we need to take to stop the spread and save lives. We must not let up. We must not let down. We must push back and push back hard on this COVID-19 resurgence. We know what to do, and we know how to do it. Now, like no other time in our BC pandemic, we must go all in to bend the curve, not the rules. We must be 100% committed to sealing the cracks and closing the gaps to give access to COVID-19. And after this week and after this report, I think all of us need to reflect and redouble our efforts. I know that in the healthcare system, people are 100% all in this effort, and we are, of course, acknowledge that considerable effort everybody is making, which is extraordinary. But we need everyone to be part of it. When in doubt, just rule it out.